this is Dr. John Hicks. I'm a spine surgeon with EmergeOrtho. Just wanted to talk a little bit about what's new, what's different, technology updates that are helping spine patients heal better. So the thing I wanted to look at today was nanotechnology, surface coatings, the way that spacers for spinal fusion have gotten better. Classically, everybody used bone graft that was from the patient, from the hip, from the leg bone, somewhere like that. That works great as long as the patient's bone is healthy. There's bone marrow in it. It's native to the body. But the problem is it hurts. It's another surgical site. There can be infection at the site where the bone graft is taken. And there's a limited amount before you start to have a problem with where that bone is taken from. Throughout time, there's been a lot of different things that people have tried to replace bone, whether it's coral or calciums or silicone products. One of the biggest ones over the past 15 or 20 years has been PEEK, which is this plastic. The great part about the PEEK was that it had a similar modulus of elasticity, or kind of the same give and density as the bone does of the spine. And the plastic doesn't heal, it just sits there to kind of hold things lined up. It was filled with bone graft, but one of the problems with the plastic, as it was used year over year, we saw that the bone didn't grow into the plastic. It kind of never incorporated. It always formed a bit of a scar membrane around the plastic itself, and the bone graft itself could heal, but the plastic was not really something the body recognized. Therefore, it's not something the body would protect from infection, and sometimes the plastic can settle into the bone a little bit more. So the engineers and the science guys come up with, how can we get around this? What can we do to make this better? The modern iterations of the spacers are, some of them are plastics, but the ones that seem to really mesh with the body the best are made out of titanium, which we have a long history with total hips, total knees, orthopedic implants. When the titanium has a porous coating, and through things like 3D printing and better technology on the nanoscale, these things are made where when the body sees it, it looks like a bone, because the porosity of the implant, the way the scaffolding of the metal is, looks the same as bone to the body. So the body can grow to it. You actually see on microscopic slides that bone grows into these titanium implants. The other thing that's kind of an unexpected bonus is the body recognizes it more as, hey, that looks like me. I'm going to protect that. So we're less likely to see infection when we have these nanomaterials that look like bone. They're less likely to collapse in the bone because it's not an environment that's dominated by scar. It's an environment that can be dominated by healthy tissue with a really positive growth basis. So this is something that's been pretty good. I've been happy in my practice that these things heal more reliably. They stay where I put them. They're not collapsing into the bone. And why are we needing this stuff? Well, the number one reason you need it is because people's spines are out of line, the disc is collapsed, the bone is shifted, they have a scoliosis or a twist, and when this spacer goes into the disc space, it restores that normal alignment where they were before they got all this arthritis, before the disc collapsed, and before their degenerative process really started. So that's something that's cool, that's really changed a lot. It's across the board in orthopedic and medical technologies for the implant to look more like the body on the nanoscale, so that the body accepts it, heals better, and has a more reliable clinical course throughout the process of surgery and afterwards.